सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर इतना कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों के जैसे पहले खुद को जय करे। हमको मन की शक्ति देना।
Good morning. Clean table. Taking classes. Jai Hind, Jai Prafull Vijayakar. आपके यहाँ 2 days. As but still yes, very essential.
Hello, Dr. Amit. Sorry to disturb you. Your voice is not audible to everybody.
Check your mic.
No, it's
Not
breaking and
audible,
it's
sir.
anybody.
Not
It's not
audible.
audible to anybody.
Hello.
Yes, sir. The voice is breaking.
Now hello. Now audible. Hello.
Yes, sir.
Yeah. Voice is clear. Or is there any breaking?
Now it is clear, sir.
Okay, fine. Great. So we are this depend on plan. A weaker sign is the later. So master
Sir, the voice is breaking again.
has- Hello. Is audible, clear? Everything is clear?
Yes, sir.
Okay, fine, great. Great. So what Master Hahnemann has mentioned in this footnote regarding the law of homeopathy. So he said that thus are the cure both physical affections and the moral maladies. How is it that in the early dawn the brilliant Jupiter vanishes from the gaze of beholders? This was the question he raised. By a stronger, very similar power acting on his optic nerve, a brightness of approaching day. This was the answer. So in the situations replete with fetid order, where with is it usual to soothe effectually the offended olfactory nerve with snuff that affect the sense of smell, and in a similar but a stronger manner. Same thing, no music, no sugar cake which act on the nerve of other senses can cure this olfactory disgust. So same thing, if you have some bad smell and if you play a loud music, that cannot be remove that bad smell. So that require a olfactory stimulus only, and it is in a stronger manner. Then and then you can have this the dynamic affection has been nullified. So this was the example he had made in this. How does the soldier cunningly stifle the piteous cry of him who runs the gauntlet from the ear of the compassionate bystander? By a shrill note of his fife commingled with the roll of noisy drum and the distant roar of the enemy cannon that inspire his army with fear, by a loud boom of this big drum, for neither the one nor the other would be distributions of the brilliant piece of uniform, nor a reprimand to the regiment suffice. So this is what, and the soldier has been injured, and soldier having a pain. So this pain has to be removed by a strong, loud noises, and so they says, yes, sir. So that make the power, make them forget this pain and everything. So this is what the stronger one repel the weaker one. In a like manner, mourning and sorrow will be effaced from the mind by the account of another and the still greater cause for the sorrow happening to another, even though it be mere fiction. So this is what we have to understand, that the person who is very sensitive to a horrible story, so he was being scared and he was being mournful and sorrow of some happening or event. When he heard some stronger event, then the older sorrow or the mourning will be removed. The same thing had been, even though it is a fictions, even in the fictions also they can understand that, yeah, my pain is lesser than that of. So that is what it relieve the thing. So this is what a nature's law of cure. The injurious consequence of the too great joy will be removed by drinking coffee, which produce an excessive joyous state of mind. So this is what he mentioned, that similar manner. Nations like the German, who have for a centuries been gradually sinking deeper and deeper in soulless apathy and degrading serfdom, must first be trodden still deeper in the dust by the Western conqueror until their situation become intolerable. Their mean opinion of themselves was thereby overstrained and removed. They again become alive to their dignity as a man, and then, for the first time, they raise their head as a German. So this is what history of Germany is. So what Master Hahnemann is telling is the nature's law of the cure. That means the weaker things is permanently extinguished and removed by the stronger one in a similar manner. Now we are going into journey of embryology. The homeopathy and modern science teaches us what is embryology. So why we need to understand this embryology in perspective to the homeopathy? So when we understand, see, we have a theory. A theory is based on a certain law, and that law also based on certain science. So this is what Sir has proposed, the theory of separations, which is based on the understanding of the Herring's law of cure. And Herring's law of cure has been scientifically proven by the embryology. So that is what we have to learn the embryology. So chapter 5, embryology, the applications of the embryology to differentiate. Why we need to understand this? The applications of the embryology to differentiate and distinguish the ideal cure from the non-ideal cure in a homeopathic practice. That means what is right and what is wrong. Second, the applications of the embryology to understand the law of cure. Applications of the embryology to know and understand the direction, the depth of the disease, and the depth of the remedy. Applications of the embryology to understand compensations in the incurable cases. So this is what our aims and objective of understanding the embryology. So we came across many diseases in, day out. Many times we see result of the cure in disease, but later on, sometimes silently or sometimes even in front of our eyes, one disease disappear and some things new erupt, and it appear there is no connections between them. It is not like that. There is a definite connections between them. That is nothing but the progress of the disease, and there is a deterioration in the health. Therefore, we must know about development and the structure of the human being. So this is what very important. Yesterday, I had one of my friend in my society. He gave me the history of his brother's surgery, and then the complication happened. So I will share that history, that he shared with this that his brother has the hemorrhoids, and it was so much so bleedings and having protruding hemorrhoids grade 4. So the surgeon advised that you should undergo the surgery, and they went to surgery. They did surgery. What happened after surgery? He developed a state of vertigo, and he cannot wakes up or from the bed. So it was a complication happened. So doctor suggests that it is mostly because of the anesthesia was given to them, and that anesthesia create this problem, that is inflammations of the brain. But what we have to understand in this case, it is not the anesthesia, it is something that help. Here the disease is progress from the mesodermal organs to the neuroectodermal organs, and that is what the we have to understand. So in that case, I advise him to give a remedy which is abrotinum. It is not the and to antidote the bad effect of. And what surgeon says that out of 100 patients, only 2% can get this kind of symptoms. So whenever you go through the Materia Medica books, and in which abrotinum has been written, that hemorrhoid suppress goes to rheumatism, hemorrhoid suppress goes to the process. So this is what the shifting of disease, which is called as a metastasis. So same way we can understand that the disease is disappear and it goes into another sphere. Why study of embryology is important? If we don't know about this, then we cannot correlate this, that this is separations. Okay. So why the study of embryology is very important? As in the third aphorism, if the clearly perceive, physicians clearly perceive what is to be cured in the disease, that is to say, in every individual case of the disease, the knowledge of disease. Very important aspect. What is disease? Disease means this is, ill at ease. So what is ease? The ease means the healthy state of the human being. Therefore, one must know about the development of the human being and development of the each organ. What organ has developed first and what organ has developed later on, that is what is a study of embryology, and this helps us to know the changes that occur in the health during the disease process. Every individual mostly spend the first 9 months, around 266 days or 38 weeks in its life within the womb of its mother. During this period, it developed from one cell structure to an organism having trillions of the cells. So numerous tissues and organs are formed and come to the functions in a perfect harmony. The first 2 months it is called as embryo, and after 2 months it is called as a fetus. So embryology is the study of the formation of the development of the embryo fetus from the moment of its inception or conception up to the time it is born as an infant. The human body is made up of the trillions of the cell. This is a result of the fusion of one male gamete and one female gamete, which is called as spermatozoa and ovum. The spermatozoon meets and fuses with the ovum, form into a zygote, and each spermatozoon and ovum contain a nucleus. The nucleus contains the chromosome. So now what is the chromosome? We have to understand the chromosome. The significance of the chromosome: each chromosome bears on itself a very large number of the structure called as a genes, and every genes is different in information stored in it of every male and female gamete. Chromosomes are predominantly made up of the nucleic acid called as deoxyribonucleic acid. We call it as a DNA. And all information is stored in the DNA, which is individual in character. This information is used to direct the activity of the cell by synthesizing appropriate proteins. This individual information of the gene is responsible for the individualization of the human being. So Hahnemann has emphasized on one aspect called as individualizations. That means he is more emphasizing on the DNA. Every individual differ from the each other, though it is manufactured in the womb in the same time and in the same manner. That's why even a twins has a different gene expressions, even in the same mother. So we know that the we have an example that one child is having. I had a case of IVF born child, twin child, and one child is autistic, and the other baby girl was absolutely normal. So how it can be happen? So it can be happen because of the susceptibility of that particular DNA of a particular child, then and then it affecting the mother state during pregnancy. So this is what we have to understand. Even though manufacturing the same womb, same time, but the genes gives a individualizations. So after that, what happens? After that, the formations of the three layer. Basically, our body is developed from one or more three layers, and that is what we call as the ectoderm, endoderm, and mesoderm. So skin is derived from the ectoderm, GIT, respiratory, urinary tract, and some part from the ectoderm and some part from the endoderm. That means a connection. So anus is composed of the ectodermal origin, whereas the rectum is composed of the endodermal origins. Also, the vital organs like the heart, kidney, livers develop from the mesoderm. So embryo proper acquire the form of three-layer disc, and this is called as the embryonic disc. This three-layer has constitute embryo disc are known as ectoderm, endoderm, and mesoderm. Now, when the zygote multiply into morula and form a blastocyst. So some blastocyst cells of the inner cell mass differentiate into flatten the cells and that come into line on its free surface, and these cells constitute endoderm. So this is what you have to see like this. This is what the whole things, and the three layer, the round is the above that is an amniotic cavity, below that it is a yolk sac, and this three layer it is called as germ cell, and this round is called as a blastocyst total. At this stage, the embryo proper is look like a circular disc, and this disc is composed of the upper ectoderm layer of the columnar cells, while the lower layer endoderm is made up of cubical cells. So this is what you have to understand: the upper layer and lower layer, columnar and cuboidal cells. Now we have to understand the Maya's Herring's law. So most important organ to the less important organ, the first corollary of the Herring. So we have seen that the human body developed from these three layers, and the development is not haphazard. Okay, there is a sequence, there is a process, but the development program is well organized, and this is in a definite order in developments. Okay. So in endoderm, one circular area formed near the margin of the disc, and this cubical cells become columnar, called as a procaudal plate. This determines the central axis and of the embryo. So it divides the central axis from the right and left half. So that is what they understand, that our body is made up on in two half, and all the material or information given to both half is the same side. Okay, and this is the head end. So this is procaudal plate, and this is called as a head end. This suggests that the procaudal plate represents the head, which is supposed to be the most important organ. Hence, it is to develop first, then any other organ in the body. This shows that the development of the embryo stands from this part, that is from more important organ to the less important organ. So this is what I have mentioned in theory of separation, that this is very important. Now, what is the significance of this? So nature gives more important to the head part, and then the side, the left and the right side also have the equal importance. So this is what very important, the head part and then both side. So Hahnemann has given importance to the side, the right and the left side. Left-sided remedies like legacy-snectomy or thuja will not affect the right side first, because the body has developed first on the right side, then the left side. So this is what the developmental effect of each and every process. If a meeting will end in between, you all are requested to join again so that we will continue our learning. The second corollary is from above downward, from head to foot. Soon after the formation of the procaudal plate, some of the ectodermal cells lying along the central axis near the tail end of the disc begin to proliferate, and this elevation is called as a primitive streak. This primitive streak is a first round, then oval, and later on linear in a structure lying along the central axis of the disc. So this is what you have to understand, the significance that this development guide us to the formation of the head first, then the tail. So we call it as a head to tail gradient, or apicocaudal tail gradients. So this development gives us the formation of the head first, then the tail. The nervous system is developed from the neuroectoderm. Here the brain develops first and then the spinal cord. Now the third corollary is center to periphery. So the spread of the intra-embryonic mesoderm. So the first round part is called as a precordial plate. Below that it is a primitive stick, oval shape, and all are covering. And this is primitive stick local membrane. Intra-embryonic measuring pass from the connecting stalk. So the mesoderm is invaginating from this to so center to face, dorsoventral mesoderm is going on. So what is that? The cell that proliferate in the region of primitive streak passes sideways, pushing themselves between the ectoderm and endoderm. So एक ectoderm होता है outer covering, endoderm inner, and in between that is passing, which is called as a third germ layer, and that called as a mesoderm. Note that mesoderm comes to lie between the ectoderm and endoderm in all part of the embryonic disc, except two plate. One is a procaudal plate and second is a cloacal membrane, and third the region of notochord. Here there is no mesoderm. So same thing what happened, we have understood that whenever in the measles, the eruptions on the upper palate, if it is suppressed, it directly went to the connection to the neuroectoderm. So there is no connection in between. So ectoderm, endoderm, in between there is a mesoderm. If it is disconnected, two plate is a cloacal membrane, cloacoidal plate, and region of not occur. So that is what we understood, that when the eruption got suppressed, enanthema is not come out and it went into CNS and producing the complication. So we have seen that the measles is complicated into the SSPA, subacute span sclerosing panencephalitis. So this is what the suppression is going on because of the developmental process. This development of mesoderm is from center to periphery along the central axis. So it was a central axis and from center to periphery, which emphasize the center to periphery development. See, I am giving you this understanding in a very brief. For a more understanding, you need to read in depth of embryology so you can understand this in a proper way. Second, the spinal cord is the central axis, and from this different nerves are formed at a different level, like a cervical, thoracic, lumbar, and sacral region. These nerves spread from center to periphery. The somoid form from the paraaxial mesoderm lies in either side of the developing spinal cord. Each somoid is divided into three parts. These are the somites. These are the head end. This is the tail end, and the side is the somites. You can visualize this. So these somites are divided into three components. One is called as a sclerotome, another is called as a myotome, and another is called as a dermatome. The sclerotome is the deepest inner one. The myotome is outer. Then the sclerotome and dermatome is exactly outer that. So you look at this. Central axis sideways, the somites. The somite has, for in the first image, you can see the very black is a sclerotome, in between is a myotome, and in above that it is a dermatome. So you can understand that this is a somites. Okay. And from center, the peripheral nerve is coming out, and then they connect to the muscles and the dermis and everything. So myotome gives rise to muscles, dermatomes gives rise to dermis, and the sclerotome gives rise to bone. So vertebral bodies and mesenchyme, it covering that. The cells of sclerotome migrate medially. So from here, a very black dot in the first figure, it migrates to cover the center. Okay, and that create a vertebral body. The cells of the sclerotome migrate medially. This sound surrounding the spinal cord from the both side and fuses to form a vertebral column and the ribs. Myotome gives rise to striated muscle, so it becomes flattened. And lateral part is called as a dermatome. It gives rise to dermis of the skin and the subcutaneous tissue, so it covers that. So very beautifully, our genetic information is encoded in the DNA that gives rise to you have to work in this order only. So significance of both A and B, so above point, spinal cord and that point, prove that the development starts from the center to periphery and from inside out. We all know. Now bone growth, skull bone growth. In the skull bone, the growth takes place in the thickness and the size of the bone by one layer of the periosteum lying over the other layer. These new layers are formed on the outer surface of the forming bone, as shown in above. Layer 2 lies over the layer 1, and third lies over the layer 2nd, and the fourth lies over the layer 3rd. Simultaneously, there is a removal of the inner layer of the bone from the inner side, and in this way, the bone grows from inside to outside. So this is what we have to understand. Bone grow from inside to outside. So long bone formations. The long bone grows in a thickness by more layers of the bones laid down over it. Inner layer, then outer layer, then outer layer, then outer layer. So this is what from center to periphery. Formation of the long bones. The periosteal bone become thicker and thicker. The second layer lies over the first and third layer lies over the second. Simultaneously, the osteoclast comes in the line of the internal surface and remove the internal layer. So the inside layer is removed as the bone growth and the development take place from inside to the outside. So you all know that when the epiphyseal plate is fusing, so it is from inside to out. So if it is fused, then height has not grown. So this is what very important aspect of. So proliferation start in between. Here you can see the cartilage cell and proliferation start in the light shadow. And then bone is growing in layer by layer. First layer, second layer, third layer, and fourth layer. So growth in length. So figure shows that the bone growth in lengthways and also growth take place from inside to out. So this is what very important understanding of our Herring's law. Long bones grow in length and in thickness as more layer of periosteums are laid down over it. The periosteal bone becomes thicker and thicker as growth takes place. The osteoclast comes into line of the internal surface of the shaft and remove bone from this aspect. As bone grow outside the shaft, it is removed from inside. So this is what they, and internally there is a marrow is making. So lengthwise also similar process take place. Significance. Bones are developed from inside to the outside. Again, this is what our corollary stating that. Now development of the lungs. The respiratory system developed from the median diverticulum of the foregut. It is a lining epithelium of the endothelium, which is of the endodermal origins. The connective tissue, cartilage, and muscles are in relation to the organ of the respirations, which are derived from the splanchnophoric mesoderm. So you have to understand that the lungs, all the lungs is made up of two variant, endoderms and the mesoderms. The free caudal end of the diverticulum become bifid. Diverticulum become bifid, each subdivision being called as a lung bud. The part of diverticulum cranial to the bifurcations from the larynx and the trachea, which while caudal to the bifurcation, the lung bud from the bronchi and lung parenchyma. The substance of lung is formed by the further subdivisions of the lower bronchi. After establishment of the bronchial tree, alveoli are formed by the expansion of the terminal part of the bronchial tree. So then the bifurcation of the trachea then also bifurcate into another bronchioles, and then it is up to the alveoli. So this is what figure A, figure B, and figure C. The part of the lung parenchyma developing from the lower bronchi are separated from the one another by the mesoderm, and this mesoderm forms the connective tissue basis of the lung and also gives rise to the pleura. So here this is something up to alveoli. It is an endodermal origin, and then there is a parenchyma in connective tissue which is made up of elastins for the expansions and the contractions of the lung. This is made from the mesoderms. And then the covering of the lungs is made from the mesoderm. It is called as a pleura. So respiratory system, including the lungs, develop from inside to the outside. Clear? Development of the kidney. For more understanding, again, I request all of you, I will share this book in the group today. So you can read again from this book. Also, you can read the embryology book so you can understand this in a proper way. Okay. Development of the kidney. So the kidney developed from the nephrogenic cord and duct. Okay. So urogenital system developed from the intermediate mesoderm. So intermediate mesoderm which forms a bulging in the posterior aspect of the abdominal. So understand this is the posterior aspect. The above lining is the posterior aspect. Then this two bulge nephrogenic duct. Okay, posterior aspect of the abdominal wall, it called as nephrogenic cord. Now what happened? The growing tip of each of the numerous branches of the ureteric bud is dilated to form an ampulla. So it started from the ureteric bud, then it develop again and then become ampulla. The cells of the metanephric blastema in contact with an ampulla undergo differentiation to form the nephron. So this is what you have to understand. The first ureter develops, then ureter goes into pelvis, pelvis goes into ampulla, and then ampulla is covered with the differentiation to form the nephrons. A solid clump of the cell is converted into vesicles, which soon become a pear-shaped and open into the ampulla. The vesicle distal part is invaginated by the tuft of capillary, which is formed into glomerulus. So this is what you have to understand. Ureter to the major calyx, to the minor calyx, and then the glomerulus. Significance. From the ureteric bud, the whole kidney also develops from inside to the outside. This development of the bone, lung, kidney, and so many other organs are from the inside to the outside. Now, what Woolpard and Weddington says about that, the scientists like Woolpard and Weddington have scientifically proved that there exist 4 different paths of supply of the food called as a nutritive gradient or animal growth axis, which we called as morphogenetic gradient. Morpho means a structural, genetic means the genes, and a gradient means the gradient path of the nutritions. Okay, all these gradients are passive, so there is no energy is consumed for the transfer of these elements. The flow of gradient is from above downward, from more important organ to the less important organ, and from center to periphery, and from inside to the outside. So petals grow step by step in a particular manner in a direction. So this direction of the growth is called as animal growth axis. If construction of the fetus take place in this direction, it should be called as a life-giving nutritive gradient. So if it is in the right direction from this, more important to less important, above downward, from center to periphery and inside out, it is called as a nutritive gradient, along which the flow of the element necessary for the growth and maintenance too. Now, during disease, what happened during disease, the toxins or the toxic protein existing are transported from the cell to cell or tissue to tissue through active transport using up energy, and this is abnormal proceed toward the deteriorations of the human life and finally the death. So from which what we infer? We infer that the more important organ to the less important organ, from above downward, from center to periphery, from inside out, and the flow of a gradient above downwards from more important organ to the less important organ, from center to periphery, and from inside to the outside. This represents the normal and the natural process to keep human being healthy. Therefore, during the cure, the disease has to follow the above criteria, and that is nothing but Dr. Herring's law of cure. What Herring's law of cure is totally based on embryology. That is nothing but the process of nature. Hence, it is called as nature's law of cure. Now we correlate this with the homeopathy. That homeopathic medicine stimulate the organ to enhance this gradient to bring this cure. Subsequently, the toxic material or the product in the unhealthy cells or a tissue are probably washed down by the pronounced nutritive gradient. As this toxin pass through the already affected tissue, transient reappear in the old symptoms. So you have to understand that when this toxin pass from this to center to the periphery, so it is transiently passing through the old organ which was affected previously. So that is called as reappearance of the old symptoms occur down the 7th layer of the skin. So what Herring's law stated that cure should take place from more important organ to the less important organ, from above downwards, from center to periphery, inside to out, and in reverse order of the symptoms appear. So applications of embryology to differentiate and distinguish ideal cure from the non-ideal cure in homeopathic practice. Now, if the pleural effusion disappear and tuberculosis appear in the lung, is it cure? The question. No, it is a suppression because pleura are external to the lungs. Absolutely. Pleura are external to the lungs. It protects the lungs. So some protection has been gone. That means it is going toward the destructions. Now we are studying another aspect of learning, that laryngotracheal groove. So it is laryngotracheal groove, site of the separations, and esophagus. So esophagus and larynx come from the same tube, and then it is divided into these two. So laryngotracheal groove is formed from the foregut by the diverticulum. The distal part of the groove is separated from the esophagus, cranial, and continue to communicate with the pharynx. Okay. So laryngotracheal groove divided into these three. So this part becomes the esophagus, and then they divided into two lungs buds. So the free caudal end of the diverticulum become bifid. Each subdivision is called as a lung bud. So you have to understand that. See, first it is a round tube, then it paginated into 3 point, and divided into this. The esophagus is separated from that, and it is connected upside to the pharynx. And the lower part is divided into two lungs bud. The part of the diverticulum cranial to the bifurcations forms the larynx and trachea, while the lung bud from the bronchi and lung parenchyma. So cranial to that it is forms the larynx and trachea, and below that it forms the right and left lungs, and then it is covering that. And behind that, so in which you have to see this figure. So bifurcations, below bifurcations, the whole covering is lung bud, and behind that one tube, it is called as esophagus. The substance of the lung is formed by further subdivisions of the lobar bronchi. After establishment of the bronchial tree, alveoli are formed by the expansion of the terminal part of the tree. The part of the lung parenchyma developing from the lobar bronchi are separated from one another by the mesoderm. This mesoderm forms the connective tissue basis of the lung and also gives rise to pleura. As the pleura lines the surface of each lobe separately, the lobe comes to be separated by the fissures. From above, we can conclude that the lung is more important organ than the pleura, because lung is from the mesodermal origin, whereas the pleura is also mesodermal, but it is outer covering, and lung is inside. So lung is more. So lung is first formed, then the pleura. Therefore, if the pleural effusion is disappear and tuberculosis is appear, it is called as bad prognosis. It is nothing but the suppression. The disease has traveled to the more important organ from the less important organ, and this is against the Hering's law. So in most of time, what happened? Whenever the patient was diagnosed with the tuberculosis, the first diagnosis found in X-ray, that is the pleural effusion. So what is the pleural effusion? It is that the body is trying to protect the lungs by making a cushions around the lungs, and that is what the pleural effusion. But what uh, conventional medicine treat this pleural effusion in terms of they tapping the pleural effusion and remove that protective barrier, and then what happen, they goes into destruction of the lung. So this is what very important. Whenever you find the pleural effusions, and then it travel to the higher miasmatic process or higher deeper disease into. So if respiratory disease has been treated and the cough and cold are better, later on, if he gets diarrhea, the disease transfer from respiratory to GI tract, which is also a suppression. As we know that respiratory tract has developed from the foregut GIT. Again, compared to the respiratory tract, gastrointestinal tract is from first, and it is more important. So again, you have to understand that the esophagus previously first develop and remove from that, and then lungs buds, and then endodermal region. So this is what you have to understand, that the GIT is more important than the respiratory. So diarrhea is treated and patient develop joint pain. Again, it is a bad prognosis. The disease has transferred from the endoderm to the mesoderm connective tissue. So this is also a bad prognosis. If the pain in the wrist joint disappear and the shoulder joint pain start, it is also bad prognosis, because disease has traveled from periphery to center. This is against the Hering's law of cure, should take place from center to periphery. So second point, application of the embryology to understand the compensation in incurable cases. So incurable cases like cancer. So if cancer is treated, and in a bargain, if the person suffer from diabetes, this is called as a compensation. Here, the disease has of a 7 layer, which was a life-threatening, got cured, and in compensation, the diabetes of the 5th layer, endocrine layer, has come up. This is a good bargain. In grossly involved cases of the tuberculosis of lung, if this is treated, and in this compensation, the part of lung may collapse or sometime pulmonary emphysema may develop. This is also a compensatory cure. So you have to understand this process into consideration. So this is what our end of understanding of embryology in a brief. It is not everything. It is just a brief outline to understand the Herring's law of cure. For more understanding, you can go through the embryology book and understand in the depth. Nowadays, also we have connected embryology with the Hammer's theory. So in that also we have to understand that the biological law of embryological disc, each disc has a particular cellular functions which gives rise to a certain disorders in this. So for example, in ectoderm, there must be always a destruction happening when the conflict is active, and when the conflict is going into healing phase, there must be some proliferations. Same way in endoderm, it is made up of the endothelial cells and the glandular tissue. In that case, it produces secretions or a development of the glandular structures in a conflict active phase to protect the body. And in the conflict resolution phase, that should be resolved by a bacteria or a virus or fungi, as it is stated in the Hammer's theory. So this is what you have to correlate your embryology with the organ development and the cellular mechanism also. So hope you have a brief idea of embryology in nutshell to understand the Herring's law of cure. Okay, if you have any query, let us have discussions for a few minutes. For more understanding, I request all of you to go and read embryology book for your upgradations of the knowledge. So this will help you to understand. There are many words and many what we call as genes is responsive for the development, and there are words they are bone morphogenetic BMP genes, and there are a lot of genes. So you have to read that so you can understand that this is certain things which we have to correlate our science with the homeopathy. Okay, if you have any questions still in these sessions, so you can ask in the chat box or you can ask directly. From tomorrow, we will going to have applied physiology. So we are, I am giving you a presentations on the applied physiology. So how the physiology to be applied in homeopathic practice, and what are the significant component of the homeopathy to understand the physiology. And physiology help us to understand certain component. For example, why we take a thirst and why we take a thermal in the patients. So that also count that the physiology help us to understand that what is the thirst and what is the thermal. So same way there are many points which we are learning tomorrow in the applied physiology. And I will share this book in the group so you all can read this book for your understanding and for your learnings. Any questions? Yes. How to understand practically whether it is compensation or it is the cure process which is stopped at particular level. See, whenever you are understanding the miasmatic process to certain extent, and the compensation most probably happen in the in the genetic mutations, in the advanced pathological disorders, not in the lower layer disorders. So you have to understand which process you are dealing with. Either most probably sir has given an idea of the compensation in the form of cancer. So whenever you are treating the cancer and cancer become better, or a patient is not palliation, no? Cancer is cured and the patient develop diabetes or patient develop hypertension. So patient, this is what we have done. So we have cut short the destination to death. That means what? We have made the patient to live longer. In a cancer, patient cannot survive longer for a time. But when the patients develop certain disorders which is psychotic in nature, that also help the patient to live longer. What is the cellular mechanism of our human body? First and foremost, survival of the fittest, the survival of the self, and then survival of the species, and then I have to defend. Okay, so if I cannot defend, I can survive longer with the certain compensatory process. Not necessary in each and every cases. Incurable, irreversible pathology, not necessary. It can happen. Even reversal, we have seen the reversal in many cases. Okay, so it is not like that the compensatory cure, but compensatory cure can be possible in incurable, irreversible pathology, but not necessary in each and every cases, provided your medicine is right. Great. Any questions? We will have 3-4 minutes left. See, for that compensatory cure, you need to understand first miasm, and after that miasmatic process, you have to understand that from where the which patient is in which miasmatic process. Mostly compensatory cure happen in destructive disorders or syphilitic disorders, which may land up into a psychosis. So, for example, I will share one genetic mutations. See, in Down syndrome, there is one things which we called as extra genes. Okay, 21 trisomy. Now what happens in Down syndrome? There is a cardiac anomalies and everything. To survive better, what body try to protect more and more and make the patient more psychotic. So most of Down syndrome children are psychotic as a compensation. It is a body's defense mechanism. But when we are giving medicine to them, what we are doing, we are just stimulating the nutritive gradient so that his development become normal. He become live normal to the normal life. Again, there is things written in the books that Down syndrome people will not survive more than certain age. So that what we are doing, we are just stimulating the nutritive gradient to survive longer for the. I had not seen any cases of the Down syndrome where the mutation has been changed. So the trisomy become normal. I have not seen that case. But in that case, we can make a compensation to live longer for a certain period of time. So that was the process. Okay. Hope you all got this uh, short things in understanding. So we, yes, after compensatory cure, like after cancer cure, DM or pressure develop, then should we stop the medicines or can try to cure the DM or pressures? If it is remain in the certain amount, it's a psychotic and patient survive in a better way, then do not treat. Okay. Whenever you are treating, sometime might it may suppress and land into again a death process. So this is what we have to understand. If it is, suppose diabetes remain 200 and the patient aged 65 years and the diabetes remain 200, and if they are giving a medicine to the diabetes and patient develop a giddiness and everything, do not treat their diabetes because that sugar is required for the functioning of the brain. Okay. Same way in a certain old age, there is atherosclerotic changes happening and they survive the pressure 180 by 110. During that phase, they do not have any symptoms, but do not treat that because of their compensatory mechanism is working at the cellular level and they survive in a better way. If you treat with the antihypertensive medicines, the pressure is getting lower and he develop giddiness and everything. So this is again that it is against the nature. So that's why do not treat that type of cases. Okay. Just advise the patient this is for your beneficial purpose. If I lower this, it may end up with the certain complications. Hope you got this. So we end these sessions. Thank you so much being with me and with all of the learning. I'm sharing this book today with the all group which I have. So you all can read this book and you can learn from this book. Okay. Thank you so much. Thank you. Thank you all.